I used to work at a daycare, and I've done that for like 30-some years. I also worked at Walmart, and I had to stand up for 10 hours a day, greeting people, checking receipts. Both of the jobs that I worked at, I couldn't afford the insurance. If I would have got the insurance, then I wouldn't have nothing on my paycheck.
30 years ago, an unmet need was recognized in our community, that there were adults that were uninsured who were unable to access health care of any kind. As we've seen needs, we've continued to meet those. We started very small with volunteers and medical providers. We recognized dental was an integral part of whole person care, along with behavioral health care. Most recently, we added substance use disorder treatment. So we continue to look for those needs in our community. We've expanded to see not only adults, but children. Any individuals who might have challenges accessing care and meeting their needs. That is why we are here.
I came here to HPC to get help with my knee problem. I get depressed sometimes because I used to ride a bicycle, and I can't do that right now. And I usually go swimming, and I swim around the pool. I can't really do that right now. And I like to walk. I love to walk. I can't do that. I get tired. I'm working with my doctor for a knee replacement.
Health Partnership Clinic is very lucky to be able to serve a number of communities. Our counties we serve are Johnson, Miami, and Franklin counties. We have clinics in Johnson County, in Olathe, a pediatric clinic on the campus of Advent Health or Shawnee Mission Medical Center. In addition, we serve Safe Home, the local domestic violence center. We have standalone clinics in Ottawa and Paola. On top of that, we also go out into the community and provide outreach, whether it's vaccine events at local HUD facilities, whether it's providing screenings and dental services at a local Head Start program, Growing Futures. We're continually taking our services out to the community where those needs are. As our name implies, partnership is key to the work we do. And during the pandemic, that became so important.
They have been so helpful in getting our staff in for virtual visits or in-person visits to really keep them safe to get back to work.
Whether it was providing testing to our partners, when the vaccines rolled out, we worked with other healthcare providers and helped vaccinate their staff.
A total of 1,200 to 1,500 people, including area congregate settings in Miami County and in Johnson County, were blessed by Health Partnership's generous donation of vaccines. Health Partnership truly stepped in at a time that we could not find resources throughout the Kansas City area, throughout the state of Kansas. I truly believe, as dramatic as it may sound, that Health Partnership saved lives at Lake Mary Center.
Key partnerships that really grew during this time were our partnerships with the local health departments. We had vaccines in some cases, they may not. They had tests, we may not. How do we come together and work together? It wasn't us against them. Vaccinating the homeless population was very important to us, so working with partners such as Salvation Army, Interfaith Hospitality Network, and Safe Home, we were able to provide vaccinations not only to the homeless individuals, but those serving that population. Health Partnership Clinic has a long-standing relationship of working with Shawnee Mission School District. So many of these kids have medical needs, dental needs, behavioral health needs. And to be able to be asked to come into one of their schools and open a clinic is such an honor.
So we do mainly primary care, pediatric care. We also have some integrated behavioral health. With COVID, we've seen a lot more mental health issues in young people, mainly with stress, anxiety, depression. The office is located in the Shawnee Mission West High School, literally across the hallway from the nurse's office. You know, I feel like the more support a student has, the more likely they are to succeed. I see these kids transition from very depressed, stressed, maybe not doing so well in school, to having more hope and, you know, being more excited about life and healing from the depression.
Beyond that, we partner with Olathe and Shawnee Mission School District and provide dental outreach services in their Title I facilities. After 30 years being here serving the communities, We are taking a pause and looking forward. So when we look at the community needs, what's next for HPC? Obviously, building more partnerships to increase access. Those are important to the work we do. We know that prenatal care in the communities that we serve is an unmet need. So in the fall, we will be starting to provide that service. But we will constantly be looking to take advantage of those opportunities that benefit our patients.
It's so important that we have clinics that we can partner with to really help the underserved population in Kansas City and surrounding areas. It's so important that we continue to fund clinics in the area to provide services for those who are most vulnerable.
I think it's very important that HPC has pioneered this in the community because it's accessibility, and we're catching a lot of the patients that really don't know where to go, they don't know how to look for an office, they don't know much about insurance. You know, some of them may be even seeing a provider for the first time.
I really like the doctors. They're excellent. They've been really good to me. I think they're helping me in a fabulous way.
It's, you know, access to quality care that is affordable.